for listening in. My name is Sarah Cummins. I am owner and founder of Waterfall Yoga and a practicing yoga therapist, certified in pain care, empowering individuals to reduce their physical and emotional pain and suffering through the holistic practices of yoga. For some of you, this may be the first time hearing the term yoga therapy, and so today I'd like to educate you on how yoga therapy is quickly becoming a non-invasive, cost-effective, and integrative component of medical care, thanks to a combination of education and scientific research that's rooted in Eastern tradition and growing into the future of Western medicine. I'd also like to clarify any misconceptions that you might have of yoga and how a yoga class differs from a yoga therapy session, what distinguishes a yoga teacher from a yoga therapist, how yoga therapy works, and how teaming with a yoga therapist might be your answer to a more innovative and efficient healthcare approach in your hospitals or practices. Let's be honest, when we think of yoga here in the Western world, we visualize a young, fit female sweating to a hot yoga class, wearing Lululemon, and doing some impossible looking pose, when in reality, yoga is and should be for every body. There is much more to yoga than how we've represented it in the Western culture. Many of us know that yoga is potentially therapeutic, but we have the idea that only certain people can do yoga. What yoga therapy brings to the table is a unique approach by working one-on-one with the individual to apply specific tools such as breathwork, movement, mantra and affirmations, meditations and mindfulness, self-reflection, and lifestyle adjustments. This is not limited to supporting a healthy, nourishing diet, reducing substance use, improving sleep hygiene, exercise, posture, and determining family work and social network support to address the individual's needs in a biopsychosocial spiritual methodology. Yoga therapy addresses a range of concerns, from chronic pain to inflammatory disease to neurological issues, mental health concerns, and illness support for diseases such as cancer, diabetes, heart disease, addiction, just to name a few. In addition to helping individuals with healthy aging for osteoporosis, balance, and flexibility. Unlike your general yoga class, clients are not coming to learn how to do yoga, but rather get help from an unresolved pain or health condition. Clients are seeking help from a highly educated and certified yoga therapist who can apply the correct yoga techniques for that particular individual in order to get them feeling better and improve their function. Unlike a yoga teacher who may only have 200 hours of training specific to more healthy and fit clientele, a yoga therapist has a specialized knowledge base and skill set that's obtained by completing 1,000 hours from an accredited training program approved by our governing board, the International Association of Yoga Therapists, IAYT. This nonprofit organization was created in 1989 in order to provide rigorous, competency-based educational standards, a scope of practice, a code of ethics, and establish yoga as a recognized and reputable therapy. The yoga therapist will spend a minimum of 2 years completing training in anatomy, pathophysiology, psychology, biomedicine, as well as yoga philosophy and the adaptation of tools to individuals' needs and concerns in areas such as cancer, grief and loss, chronic pain, heart disease, functional movement issues, anxiety, trauma, and depression, and all while completing an extensive clinical practicum mentorship. The IAYT has an established continuing education policy for all certified yoga therapists to continue their professional and educational development. In addition, IAYT has been a member of the Academic Collaborative for Integrative Health since 2006, making IAYT more recognized in our healthcare systems. Yoga therapy serves as a safe alternative to most health conditions by not treating just the illness or symptoms, but by spending a significant amount of time with a client to uncover the root of the problem causing disease or dis-ease. Much different from a traditional yoga class, the yoga therapist starts with a phone interview, a detailed intake form, followed by a physical assessment, with several scheduled follow on appointments that require the individual to work on technique and lifestyle changes at home in between sessions. The follow up appointments help the client and the therapist adjust and modify as the sessions proceed. A yoga therapist will be able to assess a client's condition, understand their limitations, and develop a multidimensional practice adapted to the individual's needs and goals as well as their interests. A yoga therapist should be able to inspire the client to practice and empower him or her to become an active participant in their own healthcare in a way that shifts their perspective in relation to their condition, therefore changing their mood and attitude, inspiring vitality to manage their symptoms and connect to a deeper purpose for life. Yoga therapy approaches each client through an acceptable doorway. For example, the physical body by affecting the musculoskeletal system with stretching, strengthening, and that in turn may also affect mental and emotional bodies through the nervous system regulation, and thus energetic and spiritual bodies through neurological processing. With such an interconnected human system, a yoga therapist is able to use one tool and affect all systems in the body. In 2003, there were just 5 yoga therapy training programs in the International Association of Yoga Therapists database. Today, there are more than 50 accredited schools representing nearly 6,000 yoga and healthcare professionals, with approximately 5,000 certified yoga therapists teaching in over 50 countries worldwide. Those yoga therapists can now be found working in hospital settings, in outpatient and physical therapy clinics, oncology, and rehab departments, as well as in private practices. In fact, yoga therapy is now recognized as a clinically viable treatment with established programs in major healthcare centers, such as the University of Texas MD Anderson Cancer Center, Memorial Sloan Kettering Cancer Center, and the Cleveland Clinic. The healthcare world's increased acceptance of yoga therapy is partly due to a significant body of clinical research that now documents yoga and its proven benefits for a range of health conditions, to include back pain, anxiety, depression, MS, diabetes, cancer, and Alzheimer's, as well as insomnia, and yoga's ability to help reduce risk factors for cardiovascular disease and hypertension. Today, more than 500 research papers on yoga therapy have been published in peer-reviewed journals, to include the randomized, controlled double-blind studies that are modern medicine's gold standard. The National Institutes of Health, NIH website currently lists over 400 ongoing clinical trials for yoga as therapy. The PubMed, U.S. National Library of Medicine website lists over 5,000 journal citations about yoga therapy. The International Association of Yoga Therapy also publishes their own peer-reviewed annual journal and triennial publication called Yoga Therapy Today. And books such as Yoga Therapy and Integrative Medicine, Where Ancient Science Meets Modern Medicine by Larry Payne, PhD, have displayed the worlds of yoga and modern medicine, uniting to serve humanity in astounding ways. It's common knowledge that Western doctors are overwhelmed by the growing numbers of diseases and number of clinical visits needed per year that are attributed to preventable concerns. Preventable concerns such as poor lifestyle habits, demanding, stressful lives that lead to anxiety and depression, gastrointestinal health issues, cardiovascular problems, and more that have a devastating effect on our physical and mental health. The effectiveness of yoga has become an attractive proposition for doctors and yoga therapists to work together at improving the health and well-being of our clients. Using a more integrative approach to medical care by referring to or teaming with a yoga therapist can improve patient care dramatically. A yoga therapist who has an hour or more to spend with a patient taking detailed notes on past, current, or future concerns could potentially refer notes to a participating physician who may have much less time with a patient. This would lead to potential access to an incredible amount of information regarding the biopsychosocial, spiritual of that patient by working together as an integrative team. The doctor would understand much more about that person more completely and could offer successful treatment, hopefully reducing the number of visits that that patient would need in the office in the future. In fact, Dr. James Stahl and his team at Harvard did a mind-body study using the techniques of yoga therapy and found that people in the program used medical services 43% less than the previous year, saving them in healthcare costs anywhere from $640 to more than $25,000 per person per year. While yoga therapy is very inexpensive compared to the cost of conventional medicine, currently HSA, HRA, FSA, and flex plans will reimburse for yoga therapy. Even Medicaid may seek reimbursement for yoga therapy if their state has approved yoga as a treatment for pain management or mental health. The Boston Medical Center is one establishment that has been successful in getting health insurance to cover the cost of yoga for those suffering with chronic conditions. As you can see, yoga therapy is becoming a robustly growing profession that is leading edge component in integrative and functional medicine as a viable alternative to traditional options. As a practicing yoga therapist and entrepreneur growing my own practice, I envision that one day Western medicine and yoga therapists will be a common occurrence in medical facilities everywhere. In my experience working with a wide range of clientele around the world, one thing is for certain and evident in the testimonials, and that is that yoga therapy is effective at healing, controlling, and reducing the symptoms of disease and high-stress living. It was my own battle with anxiety and pain as a military spouse and a young mother with a frequently deployed husband who led me to seek alternative treatments to my own healthcare. Yoga was that for me and led me to where I am today, speaking to all of you on my passion and the importance of looking outside the box for answers to health and well-being. I hope you'll consider how you can improve your practice and healthcare with yoga therapy. I want to thank you again for your time, for listening in, for getting informed on how yoga therapy is truly becoming a part of our medical world, and how we can position yoga therapy as a complementary modality in the healthcare community in a way that brings ultimate healing to our communities. If anyone has any further questions that I can answer, or if you'd like me to speak at your facilities, please contact me at waterfallyogallc@gmail.com. Thank you again for listening in and the opportunity to speak on my life's passion in empowering people to find healing in body, mind, and spirit through the holistic practices of yoga therapy.